Despite the significant morbidity associated with Tungiasis, sand flea disease, and its impact on millions of people in South America, the Caribbean, and sub-Saharan Africa, healthcare providers have largely neglected this disease until now. Study reveals that the adverse effects of Tungiasis on life quality extend beyond physical aspects and also include mental and emotional strain on affected children in rural Kenya. Nearly 80% of individuals with the disease reported a moderate to very large impact on their life quality. The extent of perceived life quality impairment correlated with the number of embedded sand fleas and associated pain. Sleep disturbance and concentration difficulties were the most commonly reported impairments. Effective treatment resulted in a rapid improvement in pathology and, consequently, an enhanced quality of life. The findings of this study provide compelling evidence that Tungiasis is a significant health hazard that warrants increased attention from policymakers and international donors. Tungiasis, also known as sand flea disease, is a parasitic skin disease caused by female sand fleas, Tunga spp, penetrating the skin of humans or animals. It falls under the category of neglected tropical diseases, NTDs, infectious diseases prevalent in tropical and subtropical regions that disproportionately affect the world's poorest populations and limit their productivity. Tungiasis has been particularly overlooked, with little research conducted on disease burden, and healthcare providers in endemic areas commonly disregarding the condition. The disease predominantly affects people living in poverty, such as those in shanty towns, rural areas, or isolated communities in South America, the Caribbean, sub-Saharan Africa, and Madagascar. Children and the elderly bear the highest disease burden, with prevalence reaching as high as 65% in these population groups, and children often carrying multiple embedded sand fleas simultaneously. In endemic areas, 95 to 98% of all Tungiasis lesions occur at the feet, with typical predilection sites being the toes, sole, and heel. Once embedded in the skin, the female sand flea undergoes significant hypertrophy, reaching the size of a pea within 2 weeks. The embedded sand fleas cause intense inflammatory responses, leading to common issues such as bacterial superinfection, pain, itching, suppuration, ulcers, and deformities. Despite the existence of effective and safe treatments, they are not readily available in endemic countries, leading to inappropriate removal methods using non-sterile instruments and increasing the risk of complications. Constant reinfection, common in endemic settings, impairs mobility, potentially causing long-term effects on household economics and school performance, mainly due to high absenteeism. Tungiasis is not easily concealable in public, especially in settings where closed shoes are rarely worn, and its association with poverty stigmatizes its victims. Children with Tungiasis often face teasing and ridicule in school. While it is reasonable to assume that Tungiasis causes mental strain and distress, no systematic investigation into its impact on life quality had been conducted until our study. Thus, our study aimed to assess the life quality of children living in a Tungiasis endemic area in rural Kenya. Community health workers identified households with Tungiasis, and children aged 5 to 14 years with at least 6 Tungiasis lesions were eligible for the study. A total of 50 patients were recruited from 5 villages, with only the first child in a household with Tungiasis being eligible. Demographic and clinical data were collected, including the number of embedded sand fleas and severity scores for acute and chronic Tungiasis. The Tungiasis-specific Dermatology Life Quality Index, DLQI, was used to assess life quality impairment, measuring categories such as feeling of shame, impairment of leisure activities, difficulty in walking, impairment of concentration during classes, social exclusion, and sleep disturbances. 50 patients, 35 males and 15 females, were included in the study. The Tungiasis-related DLQI showed that 78% of the patients reported a moderate to very large restriction of their life quality, with sleep disturbance and concentration difficulties being the most commonly reported impairments. This study highlights the significant impact of Tungiasis on the life quality of affected individuals, especially children, in an endemic area in rural Kenya. The findings emphasize the urgent need for increased attention from international donors and policymakers to address Tungiasis as a crucial public health issue, given the availability of effective treatments. Please remember to subscribe to our channel, click the like button, and activate the notification bell if you wish to see more content like this. Thanks for watching.